All right, let's talk about something that affects literally 1 in 5 people on the entire planet, but we often just brush it aside: constipation. Today, we're going to go way beyond the usual advice to find out what really happens when the simple fixes just don't work. So let's start with that number, because it's pretty staggering. 20%. That's how much of the global population deals with chronic constipation. I mean, this is so much more than a minor inconvenience. It's a huge shared experience, and, it's one of the top reasons people end up going to see a gut specialist.
Look, you've heard it all before, right? Eat more fiber, drink more water, grab something from the pharmacy. But for so many people, that's like trying to fix a super complex car engine with just a screwdriver. It's not even close to being enough. So, what's really going on under the hood? To really get why those simple fixes can fail so spectacularly, we have to get a lot more specific. You see, in medicine, constipation isn't just a vague feeling of being, backed up. It's an actual clinical diagnosis with a really precise set of rules.
Doctors have a name for it: chronic idiopathic constipation, or just CIC for short. Chronic obviously just means it's been going on for a while, and idiopathic is basically the fancy medical way of saying we're not sure about the specific disease causing it. The whole diagnosis really comes down to a checklist, which is known as the Rome 4 criteria.
Now, this is where it gets really interesting. Just look at this list. It's not really about how often you go. That's only one of the 6 points. It's so much more about the experience, the straining, the lumpy or hard stools, that awful feeling of being blocked or not fully empty. This stuff tells doctors that the problem might not be just what you're eating, but how the system itself is physically working or not working. And a patient needs to have at least 2 of these symptoms consistently to get that formal diagnosis.
Okay, so that brings us right to the heart of what we're talking about today. What happens when someone with CIC tries everything: the fiber, the laxatives, even a bunch of different prescription drugs, and they still get zero relief? Well, they move into a whole different category. At that point, they're considered to have refractory constipation. And that's not just a way of saying it's a bad case. It is a formal clinical designation that means the entire standard playbook has failed them. The impact this has on someone's quality of life is just huge. I mean, studies have shown it can be as debilitating as living with something like congestive heart failure. And on top of that personal burden, there's a serious economic cost. In the US, the direct healthcare cost for just one person with refractory constipation can climb as high as $7,500 a year. That's all from a frustrating cycle of doctor's visits, trips to the ER, and tons of specialized tests.
So the big question is why? Why do some people's bodies just resist every standard treatment out there? Well, after a lot of research, the answer often boils down to a fundamental mismatch. We're using the wrong tool for the job. Turns out the root cause usually falls into one of 2 very different buckets. It's either a problem of speed or a problem of skill.
Let's break that down, because this is key. A speed problem is what doctors call slow transit constipation. The best way to think about it is like a constant traffic jam in your colon. The muscles just aren't moving things along like they should, maybe because of an issue with the gut's own little pacemaker cells. But then you have the skill problem, which is a defecatory disorder. This is totally different. It's more like a locked door. The colon is pushing just fine, but the muscles at the very end, the ones that are supposed to relax and open the door, are either staying shut tight or, get this, actually squeezing closed at the exact wrong moment. It's a complete failure of coordination. And believe it or not, doctors can diagnose that skill problem with incredible precision. They have a special test that lets them see exactly what's going wrong. Is it like a type 1, where you've got a strong push against a door that's actively squeezing shut? Or is it a type 2, a weak push against that same closed door? Pinpointing the exact pattern is so important because obviously the treatment for a locked door is completely different than the treatment for a traffic jam. So how on earth do doctors figure out if they're dealing with a speed issue or a skill issue? Well, they basically turn into detectives. They have this amazing toolkit that lets them get a really clear picture of what's going on deep inside a person's body.
The whole investigation usually starts with a pretty simple but crucial physical exam to just feel for any muscle issues. After that, they might use something called anorectal manometry, which uses these tiny pressure sensors to make a high-def map of that push and relax coordination. That's how they nail down a skill problem. And finally, a colonic transit study does exactly what it sounds like. It tracks how long it takes for things to move through the colon, which is how they confirm a speed problem.
And this is where the tech gets seriously cool.
One of the most modern ways they can measure that transit time is with something called a wireless motility capsule. I'm not kidding. You literally swallow a pill that's a tiny computer, and it goes on a journey through your entire gut, sending back data the whole way.
The amount of detail this little smart pill gives is a total game changer. It can tell doctors exactly where the slowdown is happening. Is it the stomach, the small bowel, or is it the colon? And for diagnosing slow transit constipation, there's a really clear line in the sand. If it takes more than 59 hours for stuff to get through the colon, boom, that confirms a speed problem. And now the doctors know exactly what they need to target.
And this right here is where the story gets really hopeful, because once you have that precise diagnosis, speed or skill, you can finally stop throwing those one-size-fits-all remedies at the wall. This has opened up a whole new era of super-targeted therapies that are designed for the specific underlying cause.
So for the speed problem, you've got these advanced meds that work in totally different ways. Some, called secret gogs, basically tell your intestines to release more fluid to get things moving. Others, prokinetics, are kind of like a personal trainer for your colon. They directly make the muscles contract. And there's even a newer class that cleverly reroutes your body's own bile acids and turns them into a natural laxative.
But, drugs have side effects, and they definitely don't work for everybody. And this has led researchers to ask a really wild question. What if the solution wasn't chemical at all? I mean, is it even possible for a pill to treat constipation without having a single speck of medication in it?
The answer, amazingly, seems to be yes, and this number right here is why it's so exciting. In a study of a new drug-free technology, the rate of diarrhea, which is one of the most common side effects of constipation drugs, was less than 1%. That's incredible.
This new technology is called the Vibrant System. It's a pill you swallow that has 0 drugs in it. Instead, it's programmed to start gently vibrating once it gets to your colon. This mechanical stimulation kind of nudges the colon's own nerve cells, prompting those natural wave-like contractions to get started again. So it's a mechanical fix, not a chemical. So what do you do about this skill problem, that locked door? Well, for that, the absolute best treatment is something called biofeedback. Think of it like physical therapy for your pelvic floor muscles. For some reason, the body has learned the wrong muscle pattern. It's squeezing when it should be relaxing. Biofeedback uses sensors that give you real-time feedback, maybe on a computer screen, so you can actually see what your muscles are doing and consciously learn how to retrain them to work together correctly.
And the innovation here is just speeding up. Looking ahead, we're seeing drugs with completely new ways of working, new compounds for constipation caused by nerve issues, and maybe the most exciting thing of all, digital biofeedback. We're talking app-based tools that could bring that super effective muscle retraining right into your own home, making it easier to access than ever before. It's really a fascinating shift when you think about it. You've got a vibrating capsule that's all about mechanics, and you've got biofeedback that's all about restoring communication between the brain and the muscles. It really leaves you with a pretty big question. Is the future of treating these gut issues less about finding the perfect chemical in a drug and more about restoring the body's own natural mechanics and lines of communication?